Aggressive Breast Cancer in African American Woman by Jordan M. Burton. Agenda. Introduction, mortality rates, socioeconomic determinants, risk factors, genetics, preventative strategies, aggressiveness and biology, summary, and resources. Introduction. In the past, Caucasian women in the United States had the highest rates of breast cancer. Over time, African American women's rate began to catch up. Now, present day, approximately 40% more of African American women versus Caucasian descent lose their life to breast cancer. Mortality rates. Why are there higher mortality rates within African American women and aggressive breast cancer? Well, there's less access to screening, which leads to later diagnosis at later stages. There is also less access to best possible treatments. In the chart on the right, it explains how the mortality rates have differed between race and ethnicity. Black women lead at 28.1% higher by 100,000 women of dying each year due to aggressive breast cancer. White women don't follow too far behind, and stick at a solid 20.1. This graph is from the Susan G. Komen Foundation. Some risk factors include genetics, cultural normalities, socioeconomics, not breastfeeding, as well as smoking and alcohol use. Specific genetics that affect aggressive breast cancer are mutations on the BRCA1 and BRCA2 genes. Specific genetic predispositions, such as mutation on these genes, can lead to triple-negative breast cancer, also known as TNBC. Triple-negative breast cancer is one of the most aggressive forms of breast cancer, and it is the leading cause for the mortality rates. Another cause of the genetic section is tumor biology. Looking at a tumor in depth can help us understand what helps a tumor metastasize and what helps a tumor stay benign. Metastasize means the tumor is spreading out to different places and infecting more and more of the body. Benign is when the cancer stays local. Some socioeconomic determinants. Some social determinants begin with cultural beliefs. How people view the healthcare system can have a great impact on how often they are going to the doctors. Lack of awareness. Without being very aware of the surroundings around you and maybe your family history, it can be hard to fully understand how severe the consequences can be by simply being unaware. Low-resourced and unaccredited facilities. Depending on the environment you're in, specific facilities may not be equipped to handle each specific case. Also with that, if the place you go to you feel uncomfortable with, it can be hard when there's not several other accredited sources around. Discrimination. Discrimination within the healthcare system is a very real, consistent problem. A lot of people may believe that discrimination died out a long time ago, but it still persists. Fear. There are a lot of fear-based reasonings behind going to the doctors. The fear of finding out something is wrong. The fear of taking the step and figuring out a strategy. the fear of spending money on healthcare, the fear of dying. Something that also goes along with the line of fears are hypochondriacs. A hypochondriac is someone who self-diagnoses themselves, and it is very anxiety causing. Environment goes hand in hand with low-resourced and unaccredited facilities. Depending on the environment that you are in, can depend if there are facilities able to help you and one that you like. Some economic determinants include lack of insurance and inadequate coverage. A lot of insurance stems from the occupation you have. If certain occupations don't provide full insurance and it doesn't cover everything, it can be hard to financially fund going to the doctor. Low income levels. If there is low income, then it can be hard to put aside money just to go to the doctor, specifically with preventative strategies. It can be hard if you're debating between putting food on the table and getting a preventative screening. Food on the table usually wins. Education levels. Depending on how much education you have gone through, has a great effect on your stance and view. Access to consistent health care. As we get older, a lot of people slip away from consistently going to the doctor. It is important to have your checkup every 6 months and to go get screened every few years. Preventative strategies. Some of these strategies include going and getting screening early on, finding ways to prevent breast cancer is very important and can save lots of lives. Maintaining physical activity. Going on a walk every day is very good for regulating your body and keeping all your systems in check to keep your immune system strong. Limiting alcohol consumption, as well as avoiding smoking. Another preventative strategy that may be obvious but not too obvious is eating a balanced, nutritious diet. It is important to make sure we are getting all the vitamins in our bodies so that our body is able to fight off many different things. Breastfeeding as well. When you have a baby and if you decide to breastfeed, it releases lots of hormones that are very good for the body and for the system. Aggressiveness in biology. A few aggressive tumor agents are lack of estrogen receptors, which are also known as ER, progesterone receptors, known as PR, and the HR2 protein. The HR2 protein has a direct relationship with triple-negative breast cancer, also known as TNBC. Some struggles with TNBC is it resists hormone therapy. It resists hormone therapy due to the lack of estrogen and progesterone receptors. TNBC is also incredibly fast growing. Since it is so fast growing, it often results in a partial or full mastectomy. A mastectomy is the surgical removal of a breast. In summary, there are several aggressive forms of breast cancer that all face a unique set of challenges. It is important to address these issues so that we can begin fixing them, but this requires effort among ourselves and our community. Increasing awareness, improving medical treatment, and providing more supportive healthcare environments are some of the major contributing factors that can help women feel less alone in this and help find causes that can help stop such aggressive breast cancers. This can help the medical community work on reducing the mortality rates and improving the quality of life. My resources are from the Disease Control Priorities, the GoodRx, the Breast Cancer Research Foundation, the Susan G. Komen Foundation, and the American Cancer Society. Thank you so much for reading along my presentation with me. Have a great day.